Hello everyone, welcome back to our awareness sessions on introstomas or intestinal stomas. I am Dr. Rajesh Shinde, consultant gastrointestinal, HPB and colorectal cancer surgeon at Apollo Hospital, Navi, Mumbai. Today we have with us Dr. Rituparna Ghosh, who is a clinical psychologist at Apollo Hospital, Navi, Mumbai, and she is an integral part of our colorectal cancer support group. The understanding or the concept of the stoma, when the patients hear, that is kind of a big psychological trauma to the patients, and they are not readily acceptable for many of them. So, Dr. Rituparna, can you tell us why is stoma counseling important or necessary before the patient undergoes surgery for the colorectal cancer?
This is a very, very important question. Stoma counseling and therapy is necessary because, as we all know, we cannot segregate the physical body from the psychological or the mind. We all know that the totality or the holistic wellness of the person depends upon both the integration of the body and the mind together. As you rightly said, many people accept this fact of undergoing the surgery in a very wholehearted manner because they feel that it will relieve their chronic pain and suffering. But for some, it becomes very difficult because it is very difficult to accept the fact that some important part of my body will get altered and there will be something introduced to my body which can lead to embarrassment, shame, and people might suffer from a lot of anxiety related to how would I cope up with this concern post the surgery during the entire treatment period and the entire lifespan. They feel that how will I leave home or come accustomed or get accustomed to the daily life schedule after this surgery. So all these questions keep on popping up in a person's mind that leads to immense distress and a lot of questions that can only be dealt with proper psychosocial support before the surgical procedure takes place.
So, in a words, preoperative stoma counseling will help to get the patients mentally prepared for what is coming in their way. Dr. Rituparna, what are the psychological concerns and stresses that these patients with stoma face in their day-to-day lifestyle?
There can be varied types of concerns that are faced by people undergoing stoma surgery or who are leading a life with a stoma. There can be intense anxiety, despair, depression, and one of the major concerns they face is body image issues because they feel embarrassed with the changed thing in their body. And at the same time, that leads to marital issues, that leads to hopelessness, worthlessness, and the perception of self as less confident, lack of independence, and also they start suffering from loss of autonomy. So a lot of stressors can impact the mind negatively because of this.
Okay. So, Dr. Rituparna, can you tell us how can we extend our support to help these patients who are undergoing some kind of a psychological stress or a distress and coping up with the stomas?
Psychosocial support is needed both during the preoperative and the postoperative part of the treatment and should go throughout for a long period of time. Because the first thing we do in therapeutic intervention is to help the patient accept the change that they will undergo in a positive manner and how they would adapt to their lifestyle one day at a time, focusing on the positive impacts of this surgery. Because they have to be told that what they will gain by undergoing this and what would have been the difficulty that they would have suffered if they hadn't gone through this surgery. At the same time, we need to build up on their positive self-esteem. Also, a lot of social skills training is needed wherein they can come back to life and deal positively with the society without labeling them as inadequate and insufficient. So it's very, very important to undergo psychological counseling during the entire phase of the treatment and surgery.
So, would you like to give us any take-home message for our viewers or the patients with the stoma?
The take-home message is if anybody is struggling through such a concern and has been told to undergo a stoma surgery, please take it in a very, very positive manner. Life does not change post the surgery. Rather, it will get better by living each day at a time. And we should all understand that the need is to make yourself feel worthy. It will be difficult initially, but then better days do come after you start, the procedure and you are getting accustomed to the entire thing.
So, having a stoma does not make any patient's life difficult. In fact, it's a training with which a patient or a particular person will be accustomed to the changed lifestyle. But in reality, there will be no physical as well as psychological or psychosexual impact on a long term lifestyle of the patient. Is that
Definitely.
true?
Definitely.
Thank you. Thank you, Dr.
Thank you.
Rituparna.